My name is Jordan Clark. I am a nutrition coach, strength coach, and metabolic analytics practitioner here at CoreBlend Training Wellness. About 9 years ago, I actually injured my back from weight training. When I first injured my back, the pain that I first felt was really scary because I actually felt that I wouldn't be able to ever do things normally again. I was afraid of not being able to aspire to the goals that I set for myself. I've been through the ringer myself. I've done everything except surgery. I've had 9 epidural back injections. I've had 2 nerve ablations, gone through 9-10 months of physical therapy. I've seen multiple massage therapists. I've had days and moments where I could barely get out of the bed and walk and stand up straight. Mentally, it was a really hard place for me, and I was an athlete at that point. The doctors that I met with at that time actually told me that I wasn't going to be able to do my sport any longer. It was definitely kind of a stab in the heart. The pain made me feel pretty worthless. Bending down, putting on my shoes, picking things up, moving, I couldn't do well. It was pretty miserable. The biggest things that have helped me is honestly weight training. Getting stronger in my back, my core, my abdominals, my whole entire body honestly made all the biggest difference in the world for me. Things that helped specifically, believe it or not, sounds very counterintuitive, was deadlifting. One of the first things that you hear with, back patients or people who've suffered lower back injuries is don't deadlift. Avoid picking things heavy off the floor. And from my experience, that was one of the biggest things that helped me. It actually strengthens your lower back, strengthens your spinal erectors, which is going to help stabilize the spine. It helps develop core and abdominal strength. And the reality is, if you're living everyday life, you're going to have to pick something up heavy off the floor at some point. So why not learn how to do it with correct form and correct posture? First thing I would say is definitely, listen to your doctor, see what they say in terms of, what your limits are and stuff like that. One of the biggest things that you can focus on is just improving general strength. One of the biggest misconceptions that I've seen with clients that I've worked with and patients in the past who've had dealt with back injuries just like myself is being fearful of just lifting weights in general. One of the worst things that you can do in my experience is not training at all. The more weaknesses you have in your abdominals, your lower back, your core, everything all together, usually is going to have more of an adverse effect long term in terms of how you feel from a physical pain standpoint. You're probably going to be nervous coming out of like a back surgery or a back injury is looking at how far you have to go. What I would recommend is look at the little steps in front of you. So instead of looking at, look how far I've regressed, look at more of the controllable factors. So if it's something like working on nutrition or getting to the gym twice a week and working on a couple different exercises over the long term, try to start with small steps and small tasks at hand instead of looking at the big picture, so to speak, because if you're focusing on too many big things at once, the chance of you succeeding long term is a little bit lower. When you focus on little things and master little things, that's going to build self-confidence and self-efficacy in the weight room and just in general, and it'll carry over to feeling better long term. When you're looking at recovering from a back injury, it's not just focused on just back exercise specifically. Looking at nutrition is really important. One of the biggest things that helped me was losing weight. Losing about 65 pounds automatically made my pain better in the course of about 6 to 12 months. My recovery improved from working out and exercising. Mobility of my hamstrings specifically, so I did a lot of hamstring stretching, a lot of quad stretching, a lot of stretching to my lower back. That all improved my ailments in my back. Surround yourself with very supportive people. Listen to your friends, family, doctors. Be resilient. Think about it as a test to get better. It will get better with time and work. You're going to have days where it's going to be worse and days that it's going to be better, but long term, controlling controllable factors like your nutrition, your diet, making sure you're staying active. If you need to lose body fat, lose some body fat. All those things will help you feel better long term. It was about 9 months after I first initially injured my back where I actually saw some light. The first 6 months was very heavily dedicated towards, physical therapy and injections and all those different recovery modalities, but I didn't start really noticing a difference until about 9 months after. And I woke up one morning and I just didn't have as much pain as I normally had. I didn't really think too much about it until I woke up the next day and it felt better, and I was like, okay, then maybe we're making some progress here. So just, focus on the positive things, focus on what you can control, and just keep your head down and keep working. It was almost very emotional when I had 2 days in a row of actually having less pain, because I had 9 months of previous excruciating pain that was mood altering and emotionally altering. It was like a weight was lifted off of my shoulders. It was very reassuring to see some positive results from all the work that I was putting in to get better. There is a light at the end of the tunnel.